Hey YouTube, did you know that the biggest risk factor for heart disease, stroke, kidney disease, eye disease is high blood pressure or hypertension? There's a few things I want you to know about that, so let's get into that right now. One of the most important things you can do for your health is to manage your blood pressure well. But there are a few important things I want you to know about that. The first one is this: you cannot rely on symptoms to let you know if your blood pressure is high or not. Now, I see a lot of people, when they come into clinic, their blood pressure is a little bit high, and we start to talk about that, and they say, well, doc, I don't think my blood pressure is really high because I feel fine. I don't have any symptoms. Well, listen, most of the people with high blood pressure don't have any symptoms at all. And it's for this reason that it got the nickname the silent killer. Now, I know that's a little bit dramatic, but the point is this: you may not feel any symptoms at all, but your blood pressure is still high, and then in the background, on a microscopic level, you're getting damage to your cardiovascular system, to your kidneys, to the small blood vessels behind your eye, to your brain. Blood pressure in the background does damage to all these things, and you may not feel a thing. Hence the nickname, the silent killer. So the fact of the matter is, we can't go by symptoms at all when we're trying to decide if your blood pressure is high or not. We really just have to go on the numbers themselves. Now, it is true that some people do have some symptoms when their blood pressure is high. They might get a headache, some pressure behind their eyes, facial flushing, in general just not feeling well. Now, if you're one of those people who get symptoms when your blood pressure is high, we can use that in part of our decision-making process. But it's possible that if right here is the level at which your blood pressure is high, you might not get symptoms until way up here. So while you're getting symptoms here, you might very well be in a high blood pressure range right here, but not have any symptoms and still get all of that background damage that we're talking about. Okay, so if we can't trust your symptoms to tell us when your blood pressure is high, we really have to go by the numbers, which leads us into my second point. One isolated blood pressure reading in a medical office probably doesn't give a good indicator on what your overall blood pressure average is. So when you go to the doctor, and it could be a regular family practitioner, internal medicine, or any specialist, probably the first thing that's going to happen is they'll call your name, they'll bring you back, they'll sit you down, and they'll check your blood pressure. Well, many people's blood pressure in a medical office is not representative of their true blood pressure. Sometimes they can be a little bit higher just because of anxiety for going to the doctor, having to fill out paperwork, whatever the case may be. The fact of the matter is, some people just go to the doctor every 6 months or even once a year for their physical. And that one isolated blood pressure reading, in my opinion, might not reflect your overall blood pressure. So it can be very important and very useful to check your blood pressure at home. Now, you need to check with your own doctor to get a plan for you, but for most of my patients, if either you're taking medications for high blood pressure or the blood pressure is on the radar and we're keeping an eye on it, I recommend that you get a home blood pressure monitor and check your blood pressure at home. That way, if you're checking your blood pressure at home and you come to your doctor's office, instead of having just one isolated blood pressure reading to look at, we have a whole list of numbers that we can get a better overall average, and that really helps us make medical decisions about what to do with your blood pressure. This does bring up a point, and this is a big favor that I'm asking you guys. If you're going to go to the trouble to check your blood pressure at home, please write it down. I can't tell you how many times someone comes in with high blood pressure in the office, and I ask them if they're checking their blood pressure at home, and they say, yeah, doc, I've been checking it at home. Well, what numbers are you getting it? Oh, it looks fine. It looks good. Okay, well, what numbers? I don't remember, and I haven't written them down, but they look fine. Listen, y'all, the fact of the matter here is that many times maybe your interpretation of what is fine for blood pressure may not be the same as mine. And sometimes I see folks who think their blood pressure is fine when in fact it's actually really high and doing all that damage in the background that we've talked about. So please, if you're going to check your blood pressure, jot it down in a notebook, keep a log of it on your phone. Some blood pressure cuffs even have a Bluetooth component where it can sync directly to your phone and log it that way. Regardless, just write it down somewhere and bring a log with your visit. That way we can look at all the numbers and make a better decision for your blood pressure. Now, the last point that I want to make today is related to the other ones. So if we're asking you to check your blood pressure at home, I very frequently get the question, well, doc, how often do I check my blood pressure? So listen, for a lot of my patients, checking their blood pressure at home is an anxiety-producing situation. And we know that anxiety can actually increase your blood pressure. So a lot of times it goes like this. Someone checks their blood pressure, it's higher than they would like it to be, so they get kind of worried about it, which keeps their blood pressure up. And so then they check it again 15 minutes later. Well, it's still higher than they would like it to be, so their anxiety level kicks up a little bit, and maybe the blood pressure does too, so they check it again 20-30 minutes later, and that process repeats. Soon I'm getting a phone call saying, "Doc, I checked my blood pressure 38 times today, and it's still high and it's not coming down. What do I do?" Well, listen, y'all, I'm going to give you some advice here, and it actually might sound surprising to you, but I think that checking your blood pressure too often is actually counterproductive. We're actually not getting accurate readings when you're checking it so often. So again, you need to check with your own personal physician to get a plan for you. But for most of my patients, most of the time, I tell them to check their blood pressure once or twice per week. Not even every day, just once or twice per week. So come in, sit down, rest for about 10 minutes or so, put the blood pressure cuff on, check your blood pressure. Now, some people check it 3 times right in a row and then make an average. That's fine. Just do that, then put it away. Maybe check it one other time that week. Like we mentioned before, jot it down. That's really all you need to do. That way, the next time you see your doctor, 3, 6 months later, a year later, we have a pretty good set of data to look over to get an overall average. Now, the follow-up question I get a lot is, well, what time of day should I check my blood pressure? Because it's true, some people have trends. Some people are running a little higher in the mornings, gets better in the afternoon and evenings. Some people have a different trend. What I tell folks is just switch it around. For a few weeks, check your blood pressure in the morning, jot down your blood pressure with the time. And then a few weeks, check it in the afternoons and do the same thing. And then check your blood pressure in the evenings and write down the time and the blood pressure. And again, with all this, bring it all to your next doctor's visit, and that will help us make better decisions about your blood pressure. Okay, to sum up the main points today. Number 1, we cannot go by symptoms to tell if your blood pressure is high. We really need to know the numbers. Related to that is number 2, checking your blood pressure once every 6 months in the doctor's office might not be a representative sample of your blood pressure. So if your blood pressure is on the radar, or if you already are taking medications for your blood pressure, it would be a good idea to invest in a blood pressure cuff and check your blood pressure at home. And if you do that, please write down the numbers or jot it in a notebook or keep it on your phone so that we can look at these numbers when you come to your visit. And lastly, you don't have to check your blood pressure multiple times a day. Again, you need to check with your doctor to get your specific plan, but for most people, checking it once or twice a week is plenty. Well, listen, guys, I hope you found this helpful, and maybe your next visit to the doctor's office might be a little bit more productive or helpful to you. If you did find it helpful, please hit that like button, and I would appreciate it if you would consider subscribing and hitting those notifications so you don't miss out on any more videos. Thank you for spending time with me today, and please leave me a message in the comments and let me know, do you check your blood pressure at home? And if so, how often do you do it? But again, thank you guys very much. You guys take care, and please remember that kindness is always the best medicine. Y'all take care.